Hello, welcome back. Welcome to your third adjustment. Before you go in today, I would like to very briefly review what we talked about in the first and second video. And then today what I want to cover is what are the different kinds of healing experiences? What might you expect to experience between now and the first progress exam at 12 visits? Okay, so let's start by reviewing a little bit from the first video where we talked about the musculoskeletal system and the three main qualities that tell us that it's healthy and that we're going to work on restoring between now and the first progress exam. So, number one, fluid flexibility from the top to the bottom. Number two, stability of the spine, the ability for you to do what you want to be able to do without worrying about hurting yourself. And one of the most important factors within the stability is the muscle tone. How much muscle tension are we holding, storing, carrying around with us all the time from those accumulated stress patterns, those muscle rocks that can end up feeling just like a traffic jam inside of our body, all the energy stuck and not moving freely. And then the third thing is our alignment, upright, open, relaxed, and the presence of our spinal curves. So we're going to be working on all of that with you. The second video, we talked about how everyone has an individual healing path that unfolds in different ways. So for some people, they might notice a big change right away, right off the bat. Other people might have a little bit slower start. And then there are some people that may not notice significant change until they get halfway to the progress exam or sometimes even closer to visit 12 at the progress exam. But what we would love for you is to have faith in your body, that your body can heal. Give yourself a chance. You know, sometimes when people have a long-standing problem, they can lose faith that their body has the ability to heal. But we have seen thousands and thousands of people heal over the years from all kinds of problems, including very chronic problems. So we believe in you, and we'd love for you to believe in yourself. Okay, what I'd like to cover today is what are the different ways that healing can unfold? How does healing happen in the body? And the first thing I'd like to share is that most of the time, people have progressive changes that occur between now and the first progress exam. They just feel little by little better and better and better. But sometimes people have a path that is not a straight line, but will go up and up and down, generally in an upward direction, but sometimes with little back steps. Because remember, this is not a quick fix. We're trying to get to the root cause here. We're trying to help your body to get in touch with, reconnect, and release old, stuck, unconscious habit patterns, tension patterns, stress patterns, muscle memories. And sometimes when our body is working on transformation at that level, it can go back and forth a little bit as it's on its way to making progress. So don't worry about that. Occasionally symptoms will move around. So if you've had an issue on one side for a long time, you wake up one morning and it'll be on the other side. Or maybe your lower back has been the primary problem, but now all of a sudden your upper back is starting to feel a little bit sore and achy. So as your body, as your spine is kind of reformulating itself, is transforming, those 110 muscles that attach to the vertebra are going to have to change the way that they work with each other, especially the postural muscles. Some of them may need to get a little bit stronger, so they may feel sore for a transient period of time. And I'd like to talk now a little bit about how does the body heal as a whole in a holistic way? Because many people over the years have found that in addition to their musculoskeletal symptoms decreasing and often going away altogether, they have other changes, positive changes in other body systems that they weren't necessarily expecting from chiropractic care. So we have 11 body systems. The musculoskeletal system is just one. Here are some of the others: the cardiovascular system, the respiratory system, the digestive system, the endocrine system, all our hormones, our nervous system that orchestrates it all, to name a few. And the way that our body works is that all of these systems are intimately interconnected, interdependent. They all have to work together. They all depend on one another. But the musculoskeletal system has a very special and important role because the musculoskeletal system is responsible largely for setting the tone throughout the body and setting the tone in all of the other systems. So if our musculoskeletal system is living in a state of stress, if our muscles are tight, if our posture is bent or twisted, if we're holding on to a lot of stress patterns that are stuck in our musculoskeletal system, that has an impact in a negative way on many of the other systems in the body. And conversely, what happens when you're under care here for a period of time and those stress patterns begin to release and you come upright and your muscles relax and your flexibility comes back? Now there's a positive impact that's radiating out, sending ripples out to all of the other body systems. And here are some of the things that many people have said to us over the years at progress exams. And letting us know all of the different kinds of changes that they had experienced in addition to their musculoskeletal symptoms decreasing. Things like, I don't need to use my asthma inhaler anymore. My chronic constipation for 20 years is gone. I've had eczema on my legs for the last 10 years that's kept me up at night, and it's 90% gone. My irritable bowel syndrome is much, much better. My ulcer is healing. My thyroid test just came back normal for the first time in 5 years. There was one woman who had chronic migraines for 55 years, 3 to 4 times a week since she was 15 years old. And after 6 weeks of care, it was gone. People find that they're sleeping better, that they have more energy, that their anxiety is decreasing. People have said their depression had gone down dramatically and they were able to work with their doctor to reduce or get off of their depression medication. Their blood pressure has gone down. People are wearing Fitbits now and looking at keeping track of blood pressure and heart rate, and many people have told me that their resting heart rate has gone down about 10 beats a minute. These are all signs that the whole body is shifting more toward a healing state, out of a stress state and into a healing state. And that's one of our big picture holistic goals for you. And so when you have all of these kinds of changes, especially as your energy level goes up, your creativity goes up, your flexibility goes up, you feel so much better and you feel younger. There are many people who've been coming for wellness care for a number of years and maybe are in their 60s or their 70s, and they say, you know what? I feel better now than I did 10 years ago, even though I'm 10 years older. So we believe that the body is actually able to heal and rebalance at a very high level. And so that makes this a very exciting healing journey that we're on together. So please take note of the variety of changes that you may be experiencing. You may even want to keep a little journal and take notes about what's changing along the way. We'll do a little check-in survey with you at visit 6 that you'll fill out. And then at visit 12, when we do the progress exam, we'll get to review all of your progress and we'll talk about what to do from there. Okay, well, thank you so much for your attention and enjoy your third adjustment. All right, take care.